Governor Larry Hogan issues a stay-at-home executive order. This as cases of the coronavirus surge in Maryland. There are now 1,413 confirmed cases in the state, and 15 people have died. Hello again, I'm Lynn Bowie. The executive order goes into effect tonight at 8 o'clock. People should only leave their homes for essential needs. WJZ investigator Mike Halgren joins us live now from the state health department with the latest from the governor. Mike.
Lynn, the governor says too many people were out and about. So when can you now leave your home once this goes into effect? Well, if you're getting food or medicine, if you're checking on a family member that you're caring for in another home or checking on a pet, you can even go out to walk, but you have to abide by social distancing guidelines. And again, no more than groups of 10 people. The penalties for this, it's a misdemeanor, 1 year in jail and $5,000 fine. That's the maximum. The governor also talked about the growing number of cases, which stands at least 1,413 in the state right now.
It took nearly 3 weeks for the National Capital Region to go from 0 to 1,000 cases of COVID-19. It took just 3 days for the region to more than double from 1,000 to more than 2,500 cases.
The governor says if you have traveled outside of our region, you must self-quarantine for 14 days. He says he is soon opening vehicle emissions testing stations as drive-through testing stations for coronavirus at locations in Glen Burnie, Waldorf, and Bel Air. There's also a new drive-through testing site open at FedEx Field, but that is by doctor's appointment only. The governor also spoke about the number of deaths we've had in this area.
For those who still refuse to take this pandemic seriously, and those who are still downplaying the severity of this crisis, Dr. Anthony Fauci, the nation's top infectious disease expert, said yesterday that we could expect millions of cases in the United States and 100,000 deaths. To put that in perspective, that would mean more American deaths than the Vietnam War and the Korean War added together.
Now, there are concerns from the State Employees Union, AFSCME, about its members working at state prisons and juvenile facilities and at the Clifton T. Perkins facility, where there has been an outbreak with, we're told by the union, at least 3 patients testing positive and 1 staff member. They're still awaiting other tests. The union says that gloves and masks are in short supply, and they're calling on the state to do more. Reporting live at the State Health Department, Mike Halgren, WJZ.
Baltimore City Public Schools announced its first case of coronavirus. A staff member tested positive at the historic Cherry Hill Elementary Middle School after contracting the virus 3 days after schools closed. City officials say the teacher that tested positive has not been on the school's campus and did not hand out learning packets or meals. Multiple people are being treated for the coronavirus at Clifton T. Perkins Hospital Center in Jessup. A spokesperson for the Howard County Health Department did not have an exact number, but says the patients are both healthcare workers and inmates at the psychiatric hospital. The Court of Appeals of Maryland is also extending the length of statewide judiciary restricted operations because of the coronavirus now through May 1st. They say a person who reported for jury duty on March 9th and 12th tested positive for COVID-19. Anyone who served jury duty on those days and are experiencing symptoms should call their primary care provider or the Anne Arundel County Health Department COVID-19 health line. New York now has the most coronavirus cases in the nation, with more than 59,000 cases. Nationwide, there are more than 143,000 confirmed cases, a 300% increase from last week. And cases continue to rapidly grow in states like Louisiana and Michigan. This as investors brace for a wild trading week on Wall Street. Taking a live look right now at the Dow Jones, though, it is up 1%, 386 points. Elise Preston reports for WJZ from New York.
The Naval Hospital ship Comfort made its way to New York City today to help with the coronavirus crisis gripping the city's hospitals. The Comfort offers 1,000 beds and 12 operating rooms and will accept non-coronavirus patients. In another part of the city, another emergency hospital, this one being constructed in Central Park by the humanitarian organization Samaritan's Purse.
Volunteers started setting up this field hospital early Sunday. They hope to have it done within 48 hours, giving nearby Mount Sinai Hospital 68 more beds for coronavirus patients.
This is the kind of thing you will see now as this crisis develops and deepens.
The CDC has issued a travel advisory telling everyone living in New York, New Jersey, and Connecticut to avoid all non-essential travel for the next 2 weeks. Rhode Island officials say they will be stopping New York travelers and asking them to quarantine. The governors of Oklahoma and Texas say anyone traveling to their states from areas with hotspots will need to self-quarantine. Both are close to Louisiana, which has the second highest number of coronavirus deaths per capita.
Understand that executive orders that I issue about travel is keenly focused on one main goal, and that is to reduce importing COVID-19 into the state of Texas.
In Michigan, cases are doubling every 3 days. In Illinois, the governor says he's still waiting on thousands of ventilators from the federal government. And in Los Angeles, the naval ship Mercy took its first non-coronavirus patients to help that city with hospital overcrowding. Elise Preston, CBS News, New York.
The White House's original 15-day social distancing guidelines are now extended through the end of April. It's an attempt to flatten the curve of coronavirus cases. Medical experts on the coronavirus task force say they convinced President Trump that pulling back from social distancing now would generate another spike. The president hopes to see the U.S. on its way to recovery, he says, by June 1st. But the more immediate goal right now is to make sure hospitals have the critical medical equipment that they need. Oil prices are tanking on fears of an extended lockdown. As of Monday morning, Brent crude is hovering at around $26 a barrel, lows that have not been seen in almost 2 decades. Prices are also suffering as demand collapses and the price war between Saudi Arabia and Russia drags on. U.S. oil is trading at $20.27 per barrel, down 5.8%. It fell as low as $19.92 a barrel this morning. Stay with WJZ as we follow the coronavirus pandemic and find everything you need to know posted online at WJZ.com.